Another one I want to talk about is called splinter hemorrhage. So, if you ever see a line or a streak on your fingernails, particularly, and maybe they look red, they look brownish, they look purplish, and they look like there is blood under your nails, this is a huge one. This usually shows up when people have an infection in their heart called endocarditis. Endocarditis simply means an infection of the covering layer of the heart. The sac that covers the heart has some inflammation or, infection going on there. And this fingers tells us a lot. If I look at your nail and I see those lines, I can easily say, come on, let's do an echocardiogram and see what's going on with your heart. And I just want to say before I go on that as Black people, sometimes it might be more difficult to notice this because sometimes our nails look even darker than other people's nails. And things can be going on, it won't be very obvious. So pay attention to your body. Get to know your body so that when something changes, you can tell that this wasn't there before. So except if you accidentally hit your nail, with a hammer, a stone, or something happens to it and then there is blood, that forms under the nail like line, then that's a different thing. But if that is not the case and you see this symptom, look at the picture right there that I'm showing as well. Those are the kind of lines that I'm talking about. That is telling you something is going on. So going back to endocarditis. Endocarditis is frequently seen in people who do IV drugs, okay? These people, of course, use the needle to insert or inject the drug into their veins, and that pokes a hole in the skin. Don't forget I said anything that pokes a hole in your skin, anything that breaches your skin, that cuts your skin, can actually allow an infection to be introduced into the body. And because they are pushing this drug directly into the vein, and this carries everything right through the heart to circulate through the body, it easily goes into the heart. If you share needles with people, this can happen. So the other reasons these are common is if you do not take good care of your teeth. The body is like a maze. Everything is conjoined together. There is a link everywhere inside. So if you don't take care of your teeth and you have what is known as dental caries or holes in your teeth, food or some infection in your mouth can even just go through that, find its way into your heart and cause this problem. That's one way. Another way too, let's say you went to your dentist and they did some dental work on your teeth and your gum, and the water they used is not sterile enough, or the stencils they used were not sterilized enough, and they introduced an infection through that. It can cause an infection in the heart too. And I'm not saying that to discourage you from taking care of your teeth or from going to your dentist. You actually need to, but they have to also make sure that they are preventing this kind of thing from happening. And this is one of the reasons. If you're having a tooth pulled or something like that, they will give you antibiotics to prevent this kind of infections from happening. How do you treat this? Make sure you get to your healthcare provider as soon as you feel like you're having fevers, you're not feeling good, something is not good, and then you're seeing these splinters and lines and colorings and discolorations on your fingernails. Let your doctor see it immediately. Go to the doctor. You need antibiotics, and not just any kind of antibiotics. We are talking about your heart here at risk. If it is not taken care of on time like it should, it can, the infection can go on to damage the valves or the muscles that helps your blood to move through, to pump through the body. And what happens, you might actually need a big surgery to fix these valves, and you don't want to get to that point. So don't go buy antibiotics over the counter from one chemist or from some shop somewhere, because they can give you something that will not cover this kind of bacteria, and the bacteria will continue to grow even though you think you are treating the bacteria. Next one I want to talk about quickly is called nail psoriasis. So this condition happens if you actually have a condition known as psoriasis. So psoriasis is a condition in which the immune system overworks such that the skin cells are breaking, they divide so rapidly and uncontrollably, and this can overwhelm the immune system. You can see this condition on people's nails before you even know that they have or before they tell you they have psoriasis. So they will look like white spots or yellowish spots or even brown, like dips and pits, tiny holes, something like that on the nails. If you look at the picture on the screen, it looks like tiny dots of different colors, on the nails. And if you drop an oil, some maybe olive oil or some special oil on the nails, this will actually turn brown or dark. And that will confirm to you that you have psoriasis nails. It can also show up as, wide lines that goes across your fingernails at the bottom like this. And it will be brown, and you can tell that this is blood. So this condition actually needs medical attention. If it is mild, if it's just coming up, there can be prescriptions for topical treatments like gels, ointments, cream, can be applied topically to help heal this issue. But if it's severe already, then you have to treat it taking medicines, and your doctors will know what to prescribe for you to treat this. Last one I want to talk about for now is called transverse linear depression. So they are depressed. The nails will be depressed, and there will be that line that goes across. I want you to look at the picture right there on the screen. And this is caused by some severe infection or severe body conditions that are going on. So for example, it can be UTI, urinary transmitted infection, and that is different from STIs. STIs are sexually transmitted infection. Usually the treatments will be different. So conditions like syphilis that can stay in the body for a long time and act as if it's dead and just silently cause damage until it's full blown. Those kind of things can cause the depressed linear that you can see on those nails right there. Inadequate zinc intake can also cause this. Diet issues, like if you are just a vegetarian, or if you are just eating meat, or if you are just used to a specific kind of food and you are not taking from every group of foods, sometimes it causes more damage than help. Also, conditions like cancer can cause this. Physical injury to the nails can cause this. This will be treated by treating the cause of it. And there we have it. I hope you enjoyed this video. I hope you learned something. It could be new, it could be something not new, but don't assume that everybody knows everything about this. Don't assume that this is a general knowledge. So please share this video. There's a topic you are interested in and you want me to talk about, please leave a comment for me in the comment section. I will look into it and get back to you.